Assalamualaikum and hi everyone. Me and my group consists of Aimi Hasman, Nur Iziani Munir, Nadia Kisnia Yaakob, Nur Sahana Hanifah, Faris Aiman Zulkifli, and me myself, Siti Alia Musa, will present the given articles. As for myself, I will be explaining the first article, which entitled Hope and Optimism as an Opportunity to Improve the Positive Mental Health Demand. This article intends to point out some intervention that promote hope and optimism where mental and psychiatric health nursing play an important role. Optimists assist a person to focus on generalized expectations rather than how or why the goal is achieved. Studies has found that optimism is related to fewer symptoms of depression, high level of well-being, lower attrition rates, and stronger perceptions of social support. Meanwhile, hope as a state of positive motivation based on three components: objective, which is goals to be achieved; pathway, planning to achieve these goals; and agency, which is motivation directed toward this objective. Hope helps in promoting overall mental health and may help heal specific conditions, including severe mental illness, suicidal ideation, depression, anxiety, and trauma-related disorders. In this article also shows some strategies that promote hope and optimism in psychiatric mental health nursing. It can be addressed. There are two types of strategies, which through cognitive behavioral therapy in order to develop more positive belief about the future, and also it can be reinforced by doing simple daily actions that boost mental strength, even in the midst of uncertainty, such as emphasis on client strengths, practice gratitude through journaling, and practice hopeful thinking. Now, I will pass to Aimi to explain about Article 2.
Thank you, Aya. Hello, I'm Aimi. Now, our group will go through with the second article, which is the neural basis of optimism and pessimism. Let me introduce you to the topic. Optimism is seeing the world as full of opportunities and being hopeful of the future. Meanwhile, pessimism is seeing the world as negative and passive when encountering challenge. The most optimum for us is to have a balance between both. Pessimistic views are generally mediated by the right hemisphere in the brain, whereas optimistic attitudes are mediated primarily by the left hemisphere. However, it's not that the right hemisphere controls pessimism and the left hemisphere controls optimism, but rather it is mediated by both. Now, we will go through the cognitive mechanisms of optimism and pessimism. Optimism and pessimism are associated with distinct perceptual and cognitive modes. The principal differences are selective attention and information processing, locus of control, and attribution styles. Firstly, selective attention and information processing. The left hemisphere is more attuned to positive stimuli, while the right hemisphere is more attuned to negative information. A split visual study conducted among anxious individuals where they were assigned to watch pairs of happy and fearful faces found that there was a significant attentional bias towards the fearful face when it was presented in the left visual field, but not in the right visual field. Another study, which involved functional magnetic resonance imaging or fMRI, participants watched a series of negative photographs and were asked to reappraise them by imagining that the situation had a better outcome than the one suggested. Analysis of the brain activity showed that while participants tried to apply the positive thinking strategy, there was a higher physiological activity in regions within their left hemisphere. That is all from me. The next principal differences will be explained by Iziani. Thank you.
Alright, thank you, Annie. Hi everyone, I'm Iziani, and I'll be contributing my part, which is locus of control. In contrast, the optimists view themselves as active agents where they are the masters of their destinies, such as in the locus of control, and trust their ability to influence their environment as well as social relationships. Several studies suggest that a sense of inner locus of control is associated with Rh activation, while outer locus of control is linked with the Rh. And the next one is attribution styles. Attributions of unsensible outcomes to internal, stable, and global factors lead to a pessimistic view since these factors are beyond one's control. Conversely, ascribing the outcome to external, temporary, and local causes enables one to hope for better results in the future. Ascribing one's success to internal, stable, and global factors also enhances one's good feelings and increases his or her confidence about future achievements. As for the optimism bias, it was demonstrated in experiments where participants estimated their probabilities of experiencing a range of positive and negative events. When asked to give a second estimate about their chances of experiencing the same events, the participants tended to update their knowledge, mainly when the new information was in their favor. Analysis of participants' brain activity during the assignment revealed that the right inferior frontal gyrus was activated when the new information called for pessimistic adjustments, but not when it called for optimistic adjustments. Optimistic and pessimistic attitudes can also be induced by manipulating the brain's physiological activity in a way that selectively enhances activity in one hemisphere. Next one is hypochondriasis. Hypochondriasis is a mental disorder with excessive worry of having a serious illness that has not been diagnosed. A typical hypochondriac will interpret minor physical symptoms as signs of a serious disease. They will undertake many unnecessary medical checks and will express doubts and disbelief at the physician's assurance that he or she is perfectly okay. In a way, hypochondriasis can be viewed as the opposite of an optimism bias, which is the pessimism bias in regard to health issues. And now we continue with anosognosia. Given the consensus in the literature that the frequency of anosognosia in unilateral lesions is far greater after RH compared to LH, as this phenomenon further suggests the relatively greater involvement of the LH in painting a nicer and more optimistic picture of one condition. Studies comparing patients with RH stroke to those with LH stroke found that the former group overestimated their abilities to perform daily activities significantly more than the later group. And the last one for me is self-esteem. Those with a high self-esteem feel confident, capable, worthy, and tend to be optimistic, whereas people with low self-esteem are typically more critical of themselves, somewhat insecure, often feel incapable of dealing with life challenges, and are generally pessimistic. Psychological studies show that high self-esteem is associated with the LH, faster response time for linking good qualities to themselves, and negative traits to others were observed when the words were presented through the right ear. I think that is all from me. Thank you. Now I will pass to Faris to present for his parts.
Hi, my name is Muhammad Faris Aiman. So I will present about right and left brain function. Left hemisphere or LH is tend to be optimism such as persistence, risk-taking, and mania. While right hemisphere RH is tend to pessimism such as a body image, depression, and suicide. So the persistence is tend to be more determined and persistent in themselves effort to achieve a goal, and there are more attempts to solve the problems. So next is taking risk-taking. Optimism want to take more reasonable risk, whereas pessimism is associated with a reduced tolerance for risk, and taking a risk reflect the person optimistic forecast the outcome will be favorable. And lastly, mania. While the extreme pessimism of depression is associated with a hyper-functioning RH, so mania is elevated mood, euphoria, and unjustified optimistic, and occur when the LH is hyperactive. Next is for right hemisphere of pessimism. A person's body image is an important factor for themselves. RH involvement in negative thinking, low self-esteem, it reflects also in body image perception. The RH also mediates a more critical and judgment about other people's face and bodies. So next is depression. Depression is characterized by overly pessimistic thoughts and negative thinking style and tendency to focus and ruminate on what is wrong and magnify it, while ignoring the good things in one's life. And lastly is suicide. Suicide attempts reflect the ultimate pessimistic state and extreme hopelessness. So they demonstrate the pessimistic mode is strongly interlinked with the RH at a psychological level, such as a relative hyperactivation of the RH, as well as the anatomical level, such as having large and dense neural system in RH to subserve this mental state. And next is a plausible biological mechanism. The aforementioned studies demonstrate clearly that optimistic and pessimistic thoughts, attitude, mood, and behavior are lateralized in brain. Optimism is associated with psychological activity in the LH. They enable it to mediate a less vulnerable and more resilient optimistic attitudes. And pessimism is linked with the RH, so that neurophysiology and function that make it more suitable and to mediate and sustain pessimistic thinking patterns. So that's all for me. Thank you.
Thank you, Faris. Hi everyone, I'm Suhana. So now I will present about pessimistic thoughts as stem with fear and stress. Various studies suggest that the right hemisphere mediates a relatively more watchful and fearful mood than the left hemisphere. That means a mental state which seems to be the major factor in the link between the right hemisphere and pessimistic thought pattern. For the information, an increased neural activity in the amygdala, pulvina, and superior colliculus this was found when participants view fearful facial expression compared to neutral expression. Secondly, pessimism in regard to the unknown that lies ahead is essentially looking at the world through lenses that stand with fear, anxiety, and stress. This means ambiguous stimuli are more likely to be perceived and interpreted negatively and pessimistically when a person is under anxiety and stress. Lastly, pessimistic thinking style that anticipate negative outcome in the future is naturally associated with right hemisphere physiological activity, since pessimism and worry about uncertain future contain elements of stress and anxiety that are mediated primarily by neural circuits within right hemisphere. Then, we move on to the next part, which is optimism is interlinked with a proactive attitude. Generally, right and left hemisphere subserve different modes of dealing with the environment, which means left hemisphere mediates an active mode for achieving one's goal, such as being physically active, meanwhile right hemisphere mediates a conscious mode which balances the drive for action and promotes passive state of mind. Optimism is associated with taking an active approach for both maximizing one's well-being and minimizing threats, and at the same time having confidence about eventual success proves the optimist will continue trying even tough. Besides, regular habit of exercise and physical activity can make people think optimism and positive mood. For example, comparison among healthy people found that athletes and highly active individuals were significantly more optimistic than inactive individuals. So I think that's all for me. Now I will pass to the next presenter, Nadia. Thank you.
Thank you, Suhana. Hi, I am Nadia and I will proceed to the next part, which is dexterity breeds confidence. This is associated with optimism, where dexterity is an ability to ignore negative information and give a good image of reality. This is a perceptual and cognitive process that made through LH mediation. LH mediation and the positive feedback it received through its motor dexterity breed a sense of confidence in one's ability to manage life challenges and optimism about the future. The confidence is bred through containment of satisficing, taking risks with a proactive state of mind, persistence that lead to success, which develop higher self-esteem. And indeed, confidence is highly associated with hope, optimism, and resilience. Pessimism, on the other hand, leads to perfectionism, and it is okay to think, to find mistakes or flaws to give a better outcome. However, when taken extremely, it may lead to perfectionism. Perfectionism in the article defined as unacceptance of the need for satisfaction in some areas of life, which means they have ultimately lead to even more disappointment with one imperfect existential condition and personal flaws. And perfectionism makes someone to do constant assessment of oneself or comparison with unattainable high standards to find flaws and failures. And repeated failure by that someone will reinforce a belief of incompetency, inadequacy, and also inferiority. This vicious cycle further negative thinking patterns and may lead to a sense of hopelessness, self-blame, and eventually depression. As a conclusion of this article, optimism and pessimism are both necessary for our survival and wellness. Both optimism and pessimism have a symmetry, proportion, harmony, balance, and stability, and this article have emphasized the benefit of applying it in personal life and social relationship. There might be circumstances that optimism need to be applied, and the same goes to pessimism. And in terms of individual cerebral hemisphere, LH and RH attentiveness to the positive aspect of a given situation, a high self-esteem and a belief that the future will be bright are all mediated by the LH, and the RH in contrast is generally involved in mediating a focus on the negative side, a low self-esteem and a gloomy view about the future. And that is all from my group. Thank you for listening.